So thank you all again for participating in Hemophilia of North Carolina's first virtual legislative day. It is probably our 11th or 12th legislative day, but the first time we've ever had to do it virtually. So that is quite interesting.
You're frozen.
Am I frozen?
You bet.
Oh, okay. All right. So hopefully this works out. But so again, thank you. It's our first virtual legislative day. So I appreciate all of you being patient while we try to develop the materials that we need, make the appointments that we need. I know I said it in the email, but every year it's kind of last minute to get the appointments with the legislators to go into their offices just because they're so busy. And this year, with everything going on with COVID and of course, you know, the protests and things like that, they are busier than ever. And so some of them have not responded yet to date, and they're also not working in their offices. So Phil Poobie, our vice president, has been having to email them and correspond that way versus just calling the office and speaking to somebody immediately. So we're doing our best. Some people do have appointments, others don't. You may get an email tomorrow just asking, can you call at this time? If you can, great. If you can't make it, that's fine. We have opportunities for you to touch base with your legislators in different ways. And so we'll review those tonight. But even if you can't meet with your legislator tomorrow, just know that you can still talk with them after tomorrow. It's not the only day that you can talk with them. They're available. So I had emailed everybody a link to, it's a Google Drive is what it's called. So it's a folder that has a bunch of documents in it. I was hoping that would help to be an easy way for you to access everything. Hopefully it, you know, many email attachments can go to spam. So I figured having a Google Drive would also help with that. So what I wanted to do is just go through each of those items, not at length, but just so that you have an opportunity. If you're on the phone, you will not be able to see what I'm showing, but you'll be able to follow along, whether now or later, by just looking at that Google document or Google folder that I had put together. So in preparation for the meeting, we supplied everybody with a fast facts about bleeding disorders document. Again, I'll let you read this on your own time if you haven't already, but it's just some common facts that you might be asked about bleeding disorders, or you just might want to tell them about bleeding disorders. It talks about the different treatment centers that we have. It talks about the reduction in mortality and morbidity for patients that go to hemophilia treatment centers, also known as HTCs. So you might want to talk about, again, it's your story, so it's what's important to you. But if you go to a hemophilia treatment center or somebody in your family does, you can talk about how access to healthcare allows you to be able to go to the treatment center. And by going to the treatment center, the CDC has shown that this can cause a 40% reduction in mortality and morbidity. And again, because it's the CDC, it carries a lot of weight to it, because it's not just, you know, somebody saying, I think 40%. This is the CDC that has done the studies to prove that. Yeah. And then, so again, read that document. This number, the average cost of somebody with hemophilia is approximately $300,000 per year and can easily exceed 1 million. This is commonly debated in the bleeding disorders world as far as what that number is, because every single person is different depending on their severity of their bleeding disorder, complications that they've had, how much they weigh, how active they are. So it's really a big range. I know people that are 250,000. I know people that are $1 million a year. Again, and you could, it's the end of the day, it's expensive, and it is the difference between life and death in many situations. People with bleeding disorders can't go without their medicine, and it is expensive, and most people would not be able to afford this medication without health insurance. So that's, that's really the key point. But again, I know that people have said, oh, mine's more like 500,000 or mine's $1 million. If you know the cost of your medicine or the cost of your child's medicine, feel free to say that's what it costs for your family, or you can give an average. The next document is the do's and don'ts. Let me see, is that showing up? Okay, do's and don'ts. I'm not going to go over this. Some of these, because it is virtual, may not apply, but this is the document that we provide each year for Legislative Day. And it does help talking about relate situations to the home district. So you live there, you know what's going on. If you have time, you can do some homework about your representative or senator and find out little bits about what interests them. Are they really into farming and all that stuff? So try to relate it back. Do you have a rural hospital in the city that you live in? Because a lot of times rural hospitals are negatively impacted by the lack of Medicaid expansion. And so you'll see hospitals that are closing down because of lack of expansion. Hello, Noah.
Hey, Noah.
I know.
Hey, Noah.
Okay, and then the last one in preparation is telling your story. And again, you can use this however you want. You don't need to use it, but it's just to kind of get you thinking, because a lot of times people don't know what their story is. They don't know how to tell their story. They're not really sure where to start. And this is just a way for you to kind of get your brain thinking about that. So what is your relationship to the bleeding disorders community? I don't have anybody in my family affected, but my relationship is that I have a lot of friends that are affected and that I've seen struggle with complications of their bleeding disorder. Why are you here? What is it that brings you here? And Carol, you talked earlier about having to be your mom's advocate.
Yeah.
We are our own advocates, and we're here to make sure that people understand. And then what is one story related to rare disorder, again, in this case, bleeding disorder, that can speak to the importance of you or your loved one having access to health insurance, Medicaid if applicable. But again, it's insurance, because even if you aren't in a situation where you think that you would ever need Medicaid, you feel comfortable that you'll be on private insurance, put yourself in the shoes of somebody who might need to be on Medicaid and is falling in this gap right now. So you can speak to, if I needed insurance and this was my only option, here's why it's important. And so again, here's just kind of a prompt. If I didn't have access to health insurance, what? So I don't know if anybody is willing to share. If you didn't have access to health insurance, what would that mean?
I'm going to share.
Oh, yeah, please do.
Yeah, because it would mean, first of all, I receive SSDI from working all my life, right? Mm-hmm. So that means my Medicaid, my Medicare, there's a premium that I have to pay out of that in order to have my A, B, and D that covers some of my medication. Now, I still have to pay out of pocket for some of my medications that I have to use, but if and because I get that monthly money from working now, mind you, I put that money in the system because I worked. Now, if I did not have that, and I was just getting SSI, I wouldn't have any money to pay for anything, let alone live somewhere. I would have to live with a relative or someone. And Medicaid, also, the state of North Carolina helps with my copay. They pick up the difference on some of my copay. So I can share that. And I don't have a problem with sharing nothing in my life. You know what I mean? Because that's a blessing to people who don't have. Now, that money, instead of me, the Medicaid helps pay for my premium, which I don't have to take out because that's a part of my living money. That's a part of my car note or my other things that are of importance that helps me. So this Medicaid is important for those who don't have it. Now, how about somebody just gets SSI and they never worked anywhere? You don't get, these people don't get a lot of money.
No.
You know, I worked, so that's a difference. You know, my job was able to pay me my working benefit chalked up to enough for me to be able to maintain. Thank God, amen.
Mhm.
But other than that, this is the reason that it's important.
Yep.
Because everybody, one time or another, when you retire, you'll see what you have. You know, my mom worked for the VA as a retired nurse. She's using up right now when I think about her access to help, she can't get Medicaid. Well, she only has Part A of Medicaid. I mean Medicare.
Mhm.
Only hospital.
Yeah.
So that means her medication, there's no money we got to pay out of pocket for some medicines that cost $1,200 cash money, 1,200. And if it wasn't for certain companies that, like Pfizer, who takes care of her medicine, because they have a program that we were able to access, thank God for that. See, this stuff is important. And how about people in the poorer counties or different places here in North Carolina don't have access to any of that? They can't get their medication.
Yeah.
So they go without, and people are sick.
Exactly. And we can't afford that as a society, because long term, those people that are sick are only going to get sicker.
Yep.
So that's great. Thank you, Carol.
You're welcome.
Anybody else want to share? I'm not scared to leave that awkward silence. Jillian, I know you want to share.
I was repeating myself.
So
I think for us, so when we go in, and Noah may join me on the call tomorrow, he may not, who knows. But something that I will talk about is, like Charlene was saying, the cost of medication. So I usually go in with a bottle of Noah's Factor, and tell the senator or the representative how much this costs. So now Noah's Factor costs $5,000 a dose. And I, will share that he gets this factor twice a week. So that's about $45,000 a month that we have to pay for insurance. So that's more than $500,000 a year just for him to remain healthy. And we're very lucky that we have private health insurance through my husband's job. But if something were to happen and change and he no longer had that health insurance, or something, something happened, then we would be stuck trying to figure out how to pay for that. And as a mom of an active 9-year-old boy with hemophilia, I want him to be able to stay healthy. And without that, he would likely suffer from multiple bleeds per month, which would then lead to multiple hospitalizations, and he would require things like physical therapy. He would not be able to play soccer and all the sports he likes to play. So the access to health insurance is essential for people like us, but for the entire community who is affected by hemophilia or other bleeding disorders.
And I think it's important too to point out that, if he weren't having access to this medication, he would be missing school and his education would be impacted in a negative way. And then, if you're talking to legislators who are thinking about future taxpayers in the state, you want him to become somebody who will, be able to finish school successfully and be able to, kids with who with treatment end up being very healthy, productive people.
Yep.
I don't know, Karen, did you see me put it in the chat?
No.
Oh,
Okay.
so I actually wrote healthy, productive member of society. That's one of the phrases that has stayed with me over the years, because it's true. That's what speaks to these representatives and senators. They want to know, because it's a cycle, you know, and the whole point is that if you can help some people stay healthy and productive, then they can go back and contribute to society. So I just thought it was funny because you said it right after I typed it, and I thought, I wonder if you read that.
I was so busy trying to find the word, I didn't look at the.
Anybody else before I move to the next thing? My bar on my screen has changed. Okay, I'm going to move to the next thing. If anyone does want help, though, kind of crafting their story before tomorrow, if you are meeting with your representative, we're happy to help. Just reach out to Jillian or me, or Karen too, for that matter. Sorry, Karen, I'm volunteering you, but you've been there, done that enough times. I know you'll also be a resource for people. All right, so I'm going to stop sharing that. So again, those are the preparation materials that we had, the fast facts, the do's and don'ts, and the telling your story prompts. Next up, during the meetings, or during the day, I should say, obviously an important document is the talking point. And this is in your Google document. I won't go through it again. Typical prescription medication, upwards of $300,000 a year. Like I said, that changes for every person, what that is. But this is just kind of the average that the National Hemophilia Foundation has been using. One of the things that came out of our webinar on, what was it, last Wednesday, is that we've heard from the NC Justice Center that due to the COVID-19 health crisis, there's an estimated 750,000 uninsured North Carolinians who would qualify for Medicaid expansion if we had it. Even before COVID, there was an estimated 500,000 people that were left uninsured because of the lack of expansion. And these individuals and people, or these individuals and families, need your help. Here is a little bit of information about the ACA Affordable Care Act subsidies and how there's the sliding scale. And again, this is how Medicaid expansion is calculated. So we give an example. So a single person that makes minimum wage in North Carolina has to work 33 hours a week in order to earn the federal poverty limit, which is only $12,760 a year, in order to qualify for ACA subsidies. So that's, again, the Affordable Care Act, the Marketplace, Obamacare. You'll hear it by a million names, but at the end of the day, it's the Affordable Care Act, and it's what you would go on to healthcare.gov, and they have subsidies. So again, you'd have to work 33 hours a week to earn this at minimum wage in North Carolina. That's sad just in and of itself. A person working only 32 hours a week doesn't make the poverty level and therefore does not qualify for subsidies. So this person's policy would cost the same as a wealthier individual that makes over $40,000 a year. So again, if you make below that level, you don't get help to afford your health care on the Affordable Care Act. And they've realized that there's this gap, and that's why the federal government is offering the help that they are through providing funds for states to expand Medicaid. We've just chosen not to as a state. But here is an example of why it's important. And as we know, there are plenty of employers that, McDonald's and other fast food work, child care, there's a lot of these, what Rebecca from the NC Justice Center was talking about now, essential jobs, grocery stores and things like that are paying people minimum wage or very close to minimum wage, or not giving them enough hours to make a certain amount, not giving enough hours that they would qualify for any health insurance through their employer. So we have a lot of people that are impacted by this. Again, 750,000 according to the NC Justice Center. But this just kind of puts in perspective how unfair it is. And so this is just the talking point. You can print it out, highlight certain parts of it if you are having a phone call with your representative. If you're not having a phone call with your representative or senator, when you send them your email, you can attach this to it. And then let's see. Next one. So all right, stop share. The next one is the social media. And thank you, Karen, for working on this. I don't know why it's, let's see, this is social media posts. Okay. Is it big enough that y'all can read it?
Mm-hmm.
Okay. Again, this is just samples for you. Let me move my screen. So Google search, you can figure out your legislators' Twitter, Instagram, or Facebook pages. So if you're on social media, feel free to type in Representative Jones, NC, Twitter, and you should be able to find them if they're on there. Most of them are. Some of them don't manage it themselves. They have someone else that's more savvy to do that, but most of them are on these days. If you do, please tag us in the post so we'll be able to see it and we can share it throughout the day. So you can do it using the @sign, the hashtag sign. Karen's already put them in here. So if you were to on Facebook or Instagram and maybe Twitter too, if you start typing @hemophilia NC, it should automatically pop up with our account. And then that way we'll be alerted that you've tagged us. And again, we can share it then. Here are some examples. So it's pretty self-explanatory. Thank you to either senator or representative, first name, last name, for talking with me. So again, if you get to talk with them, if you don't, there's other ones as well. But really just trying to raise awareness. When you tag them, they know you're paying attention to what they're doing, which is nice. Next up is the email draft. And thank you again, Karen, for doing this and for making it so easy for people to try and find their legislator's email address. So again, she gave step-by-step instructions on how you would do that in this Word document. If you're not able to have a Zoom or phone meeting, you can send them an email. Again, you can always attach the talking point that we showed you. And again, this just gives you an example and it tells you kind of where you might want to insert your personal story. So go ahead and give this a read. Tomorrow, I'll be on a few of the phone calls with folks. I know Jillian's got at least one phone call set up tomorrow, but we're happy to help you craft a custom email if you want, or proof your email if you want another set of eyes on it. But Karen has done a good job of making it almost copy and paste, which I hope is really, really makes it easy for you guys tomorrow to be able to reach out to both your senator and your representative and just let them know what's important to you. And that's it for during the meeting. The only other thing I would say is I emailed some of you that have meetings tomorrow to let you know if your representative or senator is supportive of the bills that we're talking about. Those are found in the email draft. You'll find the bills, and I'll send an email out after we get off this call. But there's one for the Senate and there's one for the House.
Yeah.
And so you can literally just type in SB 834 NC. And if my internet works, it's the first thing to pop up. And the same thing with the House bill. So again, I'll send them to you. And you can You can see here what it is. I personally have not had a chance to actually read the bills yet, but you can see close the Medicaid coverage gap, so you know what it is. But here's where the sponsors are. And so this is really important before you email your senator. So for the Senate bill, that would be SB Senate bill, or your House member, and I got to move my thing, for House Bill 1040. Again, I'll email you these. Look and see if your representative is already, or your senator is already, a sponsor, because then rather than emailing them and saying, I need you to sponsor this, you can say, thank you for sponsoring this. I really appreciate it. This is why it's important to me. What else can I do to help you succeed in getting this passed? If you don't know and you send them a please support this and they respond by saying, hey, I've already signed it, that's fine. I mean, it's not the end of the world, but if you have 2 minutes, just go ahead and look at the sponsor list and just see if your representative or senator has signed on to the respective bills. Again, I'll email you the direct link to each of these bills, but I wanted to point those out. We just got the Senate bill number today.
Charlene, I have a question.
Yeah.
When Mr. Phil sent me the email on Friday the 12th, Miss Janice Fenner, she's supposed to call me at 11:55. The representative for Garland Pierce. But the email says he would like you to call him on Wednesday, June 16th, but the 16th is tomorrow.
So, and was it Phil that said the Wednesday?
Yeah.
He did that in another email. I think he just got his days mixed up, days of the week.
Okay.
So,
that was mine too, and he replied back, oh, so sorry, Tuesday. So,
okay. Yeah. I think so.
No.
I've been copied on all of his emails, and it is like a whirlwind.
Okay.
I think he just misremembered what day of the week, but it is tomorrow, and
Okay.
yeah. So you should
Okay.
be good.
Okay, good. Just making sure.
Yeah, of course. Yeah.
If we haven't gotten an email yet from Phil, do we assume that we'll just be social meeting and emailing?
Correct. Yeah. And as soon as he's getting a response from them, he's emailing and copying me on it. So today I spent quite a bit of time. There was like 30 something emails back and forth, or follow-up emails and stuff. So I did double check, and for you, I have not seen any response yet. So you may see something tomorrow, but otherwise, yeah, do social media and email and say, I'm sorry we couldn't connect. But if you want to talk any further, if you're willing beyond tomorrow, invite them to follow up with you and have a conversation on the phone.
Okay.
Again, it doesn't have to just be tomorrow, but as of now, quite a few of them have not committed to times for tomorrow. And Virginia, I know yours was scheduled and then now up in the air and all of that. So did they get it rescheduled yet? No. Okay. Yeah.
not yet.
Yeah. I just know it's busier than usual, and that says something because it's always busy. But Phil is definitely monitoring day and night, because I've been seeing the emails come through. So if I see anything from Phil and it's tomorrow talking about a meeting same day, I'll call you guys and make sure that you guys are seeing those emails, so that way you don't have to be tied to your phones, or computers. But I will call you just to see if you got that email and if you're available. And then the other two items are going to be post meeting or post social media stuff. So the first one, I would ask, there's the review sheet in a Word document in the Google Drive. This just helps us to know who talked with who sent an email, what type of connection did you have, so that way we can follow up if needed, especially if there's any notes. So if they asked you a question that you didn't know, say, I'm not sure, but I'll get back to you, or I'll have somebody else get back to you. It's actually kind of nice, because then you keep that conversation going. Don't try to make something up, because it probably won't work out, but just put it in the review sheet. Again, if you talk to them, who did you talk with? Some people right now are either set to talk with the legislative assistant or might end up talking to the legislative assistant last minute. So if you didn't speak with the representative or the senator, just let us know that. And then again, what type of contact did you have? So you can fill this out in a Word document and email it back. You can print it out and take a picture and text it to Jillian or my cell phone. I'll send those in the email as well. Or you can just simply send us an email back and just write out the answers to this. Whatever is easiest for you. We want to make it easy, but we also just want to know how your day went. And then last,
I would just add to do it as soon as you're done.
yes.
Because, I mean, it is different than when we're running all over from one appointment to the next, but it is also very easy to forget what exactly your conversation was.
Mm-hmm.
So I would recommend doing it as soon as your meeting is over, if you have a meeting.
Yes, good point. Yeah, I'm really bad. And Nathan, I know you're on now, so you can probably speak to it from the NHF perspective, but at the National Hemophilia Foundation Washington Days, it's the same thing. If you don't do it right after the meeting, I don't know, there's like a 50-50 chance that you're going to get busy or you're just going to simply forget some main point or some piece that you probably should have written down.
Yeah, and it's also, they meet with a lot of people. They hear from a lot of constituents. So you can easily get lost in the shuffle if you don't do it shortly after your meeting. So yeah, I agree. And especially now, given that we're not actually able to have the face-to-face interaction. So if anything comes up in your conversation and they really sort of hone in on it, or they're just like you, sometimes when you talk about the cost of treating bleeding disorders, you watch people's faces, their eyes like get really big and they get almost a little fearful. They just can't believe it. If there's anything like that that sort of stands out for you, include that in your email because it probably will stand out for them as well.
Mm-hmm.
And I just wanted to reiterate something that Charlene said that I think is really, really important, and that is about figuring out if they're already a co-sponsor of the legislation. Because I've seen advocates go in and they start to make their pitch, and the legislator will say, I am already on that bill. You don't need to waste my time or yours. And it can be very embarrassing, frankly. And it's not a good use of either of your time. It really isn't. But what Charlene said that I want to emphasize is if they are already on, or they agree to go on in your meeting, say thank you and what else do we need to do? Because they've got insider knowledge about politics and interpersonal dynamics within the legislature. So they might be able to give you a useful tip, and you need to bring that back to Charlene and the chapter, and we can utilize any kind of insider information that you might learn about tomorrow.
Mm-hmm. Yes, definitely. Yeah, don't ever doubt if a small piece of information might be helpful, because when in doubt, write it down and we'll figure out if it is or isn't. And then the last thing, I don't know, call me old school. I love a handwritten card. I think that there's just something to be said about not only sending one, but receiving one in the mail. I don't know how many of you guys still have cards at your house. Usually we'll provide them when we have a physical legislative day in the folders for you guys. If you want me to mail you one that you can send to your representative and senator, I'm happy to mail you one. Just please email me or text me so I don't forget to do it. But if you have one and you have the time, take 5 minutes and handwrite a thank you. Here's sample text.
Mhm.
Again, if they've already signed on, thank them for doing it. If they haven't, ask them to please consider it. If you had a phone call, thank you for taking the time. If you didn't have a phone call, I'm sorry we didn't get to touch base. I know you're extremely busy. I hope to meet you sometime soon, blah, blah, blah. So personalize it to whatever you want, but I enjoy getting it. If you have trouble finding your representative or senator's address, you probably won't, especially if you're looking them up for social media purposes and things like that. The North Carolina General Assembly's website has gotten pretty easy to use, but if you have trouble finding their office address where you'll send it to, let us know, and we're happy to help you find that. But I think a handwritten card does not hurt. I'll say that much.
Yep.
You know, I think emails get responses and handwritten cards don't necessarily, but you're just thanking them in the card. You're not looking for a response necessarily. But if they do become your pen pal, let us know, because that'd be kind of cool. And then the
it still
last
means a lot. I think cards and speaking to and letting people know by mail means a lot still. Even though we have all this technology, it still means a lot to receive a card, knowing that somebody, they paid attention to it.
Exactly. I think so too. I mean, I love getting cards. I love sending cards. It's something I was raised to do, and I don't know, I'll do it. I know kids that don't even know how to address an envelope these days. I've had to actually show people that.
That's true.
So, I don't know. It is what it is. And then the last formal ask for you guys would be, if you have take a picture. We don't have any photos because we're not doing in-person events this year. So if you have a phone call and you want to take a selfie, well, I guess you're on the phone. Somebody else, if you have somebody else in the house wants to take a picture of you on the phone, or you sending an email or something, I don't know, get creative. You don't have to, but if you can, it'll be the only photos that we have of Legislative Day because we're not together. If you have a red tie from a past Legislative Day or Washington Days, put on your red tie. I have mine somewhere around here. And
I have mine right behind.
see, and I have so much stuff. My lamp is going to fall over. I think my red tie's at the office. But anyway, I'll have to grab that. But just take a photo if you can. Again, we'll send you our cell phone numbers so you can just text them to us and make it easy, and we'll post throughout the day to just kind of keep it going. Okay, so go ahead, Jillian.
Going to say there was a comment in the chat a while ago from Erin about a person does not qualify for Medicaid unless they have a dependent. And Nathan did answer that in states that have not expanded. That's true. Medicaid expansion would change that. From the webinar last week, Rebecca talked about, if you have no children, you are not eligible for Medicaid at all. And then my God, my brain just kind of went poof. But unless you are a pregnant woman, if you're blind, we're living with a dependent. I think that was everything.
Yep. So again, there's a lot of people that fall outside of those categories that need access to health care.
Yep.
Any questions from folks? I mean, anything that, again, that you have questions about, concerns? And so one of the things too, so when you're talking in the email, we'll kind of show you where to tell your story or where to give an example. But in the phone conversation, you'll introduce yourself. If you get to a phone conversation with them, I'm one of your constituents. I live in this area, and I wanted to talk with you today about the importance of health insurance or the importance of access to care, especially if you have a Republican senator or representative. And again, I hate to say that, but there is a big divide between Democrats and Republicans on this issue as far as Medicaid expansion is concerned. So chances are, if you're talking to a Republican, they're probably against Medicaid expansion in North Carolina. So for them, the terminology of access to care, they know what you're talking about, but you're not saying Medicaid expansion, which just can turn them off completely. But so I'm here to talk with you today about the importance of access to care. My son, blah, 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 or I have blah, blah, blah. And I think when you can really pull them in with the story when you're on the phone with them, or again, when you're in person with them, because then they're listening to you. You're telling them about yourself and your family who live in their district, and then talk about, and this is why I'm asking you to support this bill. So I would say in any phone conversation, face-to-face conversation, give them the hook of who you are and why this is important to you, and then hit them with the, here's what I'm asking you to do. In the email, either could go. I'd say, because sometimes they're strapped for time with email, and you might only have the first couple lines, go ahead and put that up front and then say why it's important to you, so that way they know right off the bat when reading your email what you're asking for. Any other questions? No, Reed, come on.
Absorbing everything.
Huh? You'll read everything?
We're absorbing,
Oh, okay.
and it's very good for us.
Good, good. I'm glad. And again, the documents in the Google Drive should help. I apologize that we weren't able to have them to you earlier. This has just been a lot, as you can imagine. So again, I just apologize for not having them to you sooner, but hopefully you'll have enough time to read them. I'm available, later tonight. My bedtime is usually 10 o'clock. So if you call after that, my phone will be on silent. But then tomorrow I'll get started probably by 7 a.m. So feel free anytime tomorrow. I'm going to put my cell phone in there to just call me or text me. And I think the puppy peed in the house. She's getting scolded. Sorry. Day in the life of a new adopted dog. I don't know if y'all can hear it, but he's no. Anyway, so I might be up earlier than, or I might be working earlier than 7, depending on how this night goes. But anyway, but again, I hope you guys have a great experience tomorrow. I look forward to.
Thank you. I'm excited.
Me too. Me too. I'm looking forward to hearing how it all goes, and I can't wait until 2021 when we can be doing this in person in Raleigh. I'm gonna say great weather, because one year it was way too cold, next year it was way too hot. So 2021, it's gonna be perfect weather. There's gonna be free ice cream.
I find it somewhat ironic that it's supposed to be chilly for June and rainy tomorrow when we were going to be there anyway. And last year it was cold and rainy when we were there in February.
Mm-hmm. Yeah.
But then we were complaining the year before because we were roasting on the sidewalk. We just can't win.
No. So, well, hopefully everyone will. Well, I guess they're all phone meetings, so you don't have to worry about internet connections, because if we had done webinars, that was another concern too. But anyway, well, thank you all. Again, I'll send you an email shortly with the Senate bill number, the House bill number, and then with Jillian and my cell phone numbers. And yeah, have fun tomorrow. Thank you all very much. And I know I'll talk with some of you on the calls.
Welcome.
Thank you.
Thank you.
Good night, everyone.
Thank you. Good night.